Extract 1, questions 1 to 12. You hear a foundation doctor talking to a recently admitted patient called Roy Miller. For questions 13 to 24, complete the notes with a word or short phrase.
So, Roy, I see from your notes you've been admitted because of shortness of breath. Can you tell me more about that, please?
Yeah, well, it started last week. I noticed that getting up the stairs was more of an effort, and I found that I had to pause on the way to catch my breath.
Right.
I did used to get a little out of breath, but it's definitely gotten worse. I normally manage to go shopping with my wife, and we walk to the shops and back. I generally have to have a little rest, but now everything is just taking me longer. I feel weary, and I've got this cough. It's like a barking thing that I just can't shift. It's worse at night when I'm lying down and I get a bit wheezy. I'm just really tired because it keeps me awake for most of the night. My wife has been sleeping in the spare room because it's keeping her awake. I've also sort of been bringing things up when coughing. Without being too graphic, it's quite thick. It's a sort of dirty green color, I suppose.
Right.
It wasn't like that at the beginning of last week. It was just clear. But over the last couple of days, I've noticed it's changed color, and I'm coughing up a lot more. My wife was starting to get worried, so she made me an appointment with our doctor, and then he sent me here.
Okay, Roy. Do you have any other symptoms?
Yeah, I was really hot yesterday, and I thought it was because the heating was on, but my wife hadn't turned it on. Then the next minute I was shivering. I guess I'm feverish.
It sounds like you've been really suffering. Have you got any other medical conditions?
Well, I was diagnosed with this lung condition last year. I've forgotten the name of it. Hold on. Hang on, I'll get it. COPD, is that it?
Yeah.
Well, anyway, they told me that my lungs weren't working as well as they could be because I used to be a smoker.
Right.
But I quit about 6 years ago. To be honest, I think it was because I worked in the mines and it was really dusty. Either way, I've got it, and it makes me a bit breathless, but nothing like this.
Right.
And I also get gout from time to time, and I take something called allopurinol or something. I've also got arthritis in my knees, but that's just because of my age, so I just put up with that.
You mentioned taking allopurinol. Are you on any other medication?
Well, the doctor gave me inhalers, and I'm using those. I'm getting better at taking them because I found it a bit confusing at first. I've started to take my blue inhaler a lot more over this last week because I've been so breathless. I take the stuff I mentioned before, a statin for my cholesterol, and then the odd paracetamol when my arthritis starts to play up. I don't really like taking pills, but if it keeps me going, then it's worth it. Also, I'm allergic to penicillin. I get an awful rash all over my body, and it's so itchy whenever they give it to me. Don't give me any of that.
We won't, Roy. You mentioned you live with your wife. Are you both managing at home?
Oh, yeah. We still get around the town to get our shopping and see the family. The stairs are starting to get a bit much now, so we're thinking about moving into a bungalow, but we haven't started looking yet.
Okay, that's good. Have you got any ideas as to what might be going on?
Well, I think it might be a chest infection because it's just getting worse. I just want to start feeling better.
Of course, Roy. It does sound like that might be the case, but we'll start doing some tests to make sure and begin treatment.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Greg Freeman, who's been referred to her by a sports medicine clinic. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
OK, Greg, so I have your notes from the sports medicine clinic, and it looks as if you've had quite a few problems in recent years.
Yeah.
Would you like to talk me through them?
Okay, well, the first time I got hurt was 2 years ago. I took a fall while I was rollerblading, and I hurt my right wrist here on the side. So I didn't do anything right away, but next day I went and saw the doctor, and they gave me an x-ray, but they said they couldn't see anything wrong, and they just gave me some exercises to do.
Right.
Then a year ago, I hurt my right shoulder here when I came off my snowboard and hurt myself. That's never really gotten better.
And I understand you've had about 10 visits to the clinic over the last 2 years. So that's your right wrist and shoulder?
Mm-hmm. And other joints, too.
Tell me about this pain in your shoulder. Is there anything that makes it feel worse?
Well, I like to do a lot of exercise, but that definitely makes it worse. Like if I do a set of pull-ups in the gym or rowing, or if I'm using the free weights, pretty well any sort of exercise I do, I find the pain's pretty bad.
Right.
And it's not just when I'm in the gym, it's constant, all through the day. There's no fluctuation, so I never get a break from it. It's really got me down, and no one seems to know what to do about it. They've diagnosed various different things, and I have to lie on my left side at night, or the pain disturbs my sleep, so that's not easy.
So, apart from that, are you generally in good health?
I suppose so. But what I've noticed is that my right wrist sometimes feels cold,
OK.
and there's no reason I can see for that. And the same for my left knee. It suddenly goes cold. It's very strange. When I told the doctor about that, he checked to see if the blood flow was okay, and it was.
Right.
And he asked if I felt any numbness there, but I don't.
OK. That's quite strange. And have you had any medical problems in the past?
Well, the only thing really is, I used to have really bad acne. It started when I was about 13, and I got it on my face, and then it spread to my back, and nothing I did seemed to have any effect on it. Like, first, my mom went to the pharmacy, and she got this stuff I rubbed on. I can't remember the name. It was something peroxide.
Benzoyl peroxide?
Yeah, that's it. But that didn't do any good, so my mom took me to the doctor, and he gave me antibiotics, and they didn't do much either. Then I read this article that said it can be caused by your diet, and you should cut out dairy products. So I did that for a bit, but it just got worse. And it got so I didn't want to go out or anything. So then my doctor referred me to the hospital, and I saw a dermatologist. She was really nice, and she prescribed me some stuff that was much stronger, and that did have an effect for a bit, but I got really dry lips, and they started cracking and bleeding.
OK.
And another side effect, well, she said she wasn't sure it was due to the medication, but I think it was. Every so often, I started getting this awful depression. So, in the end, I stopped taking anything, and it seems to have sorted itself out.
Yes, your skin looks fine now. Right, so let's have a look at this shoulder of yours. Can you...
That is the end of Part A. Now look at Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25.
So, can I listen into the baby? Yeah, of course. Are you managing to do any exercise at all? Mm-hmm. Not really. No. And I go for walks some evenings, but not every evening. Well, walking's really good. Yeah. Yeah, and you can practice on your back and hands down. And how many weeks are you now? 22. Just right. That's really good. So I'm just going to feel around. Tommy, did they do this at the hospital? No. Okay, so I feel the biggest part of the baby is the head. So you start feeling for the head or the bottom. Mm-hmm. The hardest part's at the bottom of the head. Okay. And then with my hands doing this gently, the baby's been moved in the fluid. Yeah. And I can feel, just go soft, sink into the, are you comfortable? Yeah. It's not easy with a camera on you, is it? And I can just feel the back of the baby, which is over on this side. Okay. And then this might, because I'm pressing down, so take a breath in. And as I press down, it might be a little bit uncomfortable. You breathe out, go. Oh, very good. And we'll do that again. And then breathe out. Okay. So the head's down. That's the bottom then we're feeling here. Mm-hmm. This bit here, because the widest part is down there. And there's plenty of space. Yeah.
You know, nurses often play an integral role in all of our lives. They're the comforters and caregivers in the best and worst of times. And this week is National Nurses Week, by the way. And Perry has a very touching story of a nurse and her patient.
Yeah, well, Nicole Leroy has lived this story for the last year and a half, but it's just now being told. A stop inside the Little Clinic in the Hyde Park Kroger during her lunch hour one afternoon, and a chance meeting with the nurse working that day may have saved her life. This is a journey Nicole Leroy has been waiting a year and a half to take, back to see her nurse at the Little Clinic.
Hi. Oh. How are you? Good. I just want to thank you.
Jessica Smith, a family nurse practitioner at the Little Clinic, listened to Nicole, something several doctors hadn't done.
You researched, you looked in your book, you tried to figure out what it could be. And a month later, I found out that I had cancer.
Cancer, stage 2 Hodgkin's lymphoma.
I'm 36 years old. I'm in the best shape of my life. You don't think it could happen to you.
A diagnosis a year in the making.
I've been to a gynecologist, a dermatologist, primary care twice. And each one of them told me that I was either just virus clogs in my lymph nodes, or that I was self-inflicting, or that I had depression, I had anxiety.
But Jessica thought it could be serious, so she encouraged Nicole to keep fighting.
She looked me in the eye and she said, you need to go follow up further. You need to go see your doctor again. You need to push.
Internal medicine. So you as a doctor may be seeing dozens of patients in a single day. How will a system like this affect your day?
Well, I'm an emergency physician, so I work in an area where there's patients in rooms all around me. They all have questions. I can't tell you the number of times a day I see a patient limp out of a room and they want to know when lunch is coming. If we could get them the answers without them having to come out and search for someone to answer the question, it's a win for everybody.
These devices are incredibly simple. There's just two buttons on it that you need to know about. The first one is the green one which says on and off, and that's the first step. Stage 1, turn it on.
Call emergency medical services now.
It tells you exactly what to do.
Remove all clothing from chest and stomach. Peel off the pad labelled 1.
Now we've got the pads on the patient's chest. The next thing is the device will analyse the rhythm and recommend a shock if appropriate.
Patient. Shock advised. Stand clear.
Now it's asking me to press the button to give the shock.
Shock delivered.
So that's the shock delivered. Now what will happen is that you'll carry on doing CPR if appropriate, and the machine will go into a cycle then when it reanalyses and gives further shocks if need be. But all you need to do is just listen to what it's telling you.
Begin CPR now.
And this one's even got a little button that if you press it, it'll give a sound prompt so you can get your CPR at exactly the right rate. Trust me, if I can work one, so can you.
Excuse me, I'm a little chilly. Can I have that blanket, please?
What? What do you mean?
The blanket. I'm a little cold.
Did we do surgery on your arms?
Excuse me?
Did we do surgery on your arms?
No, but I'm in a lot of pain.
I want to see you go grab that blanket and pull it up. There is no reason why you can't pull that blanket up.
I have a lot of back pain, though. Can I have some medication?
Well, you're supposed to be in pain. You had surgery, so you're going to be in some pain. Hold on a minute.
I have a lot of pain, though, ma'am.
Okay, I'll be in a little bit.
My name's Phil. I'm an instructor, and Holly's a student working with me. We're going to be taking care of you today. Would it be okay if we ask you a few questions?
Yeah, that was fine.
Okay.
I'm just going to verify your first and last name. If you could tell me your first name for me.
It's Lori.
All right, and last name?
Smith.
All right, and your birth date?
August 1st of 1974.
All right, and Lori, what do you prefer to be called?
You can just call me Lori.
All right, it's nice to meet you.
Thank you. Yes, nice to meet you. So Lori was admitted last night with an asthma exacerbation.
Okay.
During the night you had a couple of breathing treatments, correct?
Yes.
Okay. You feeling better since the breathing treatment?
Yeah.
Okay. They also gave her some prednisone as well during the night.
Okay.
So the plan hopefully is to have you discharged later today if you continue to feel better.
Okay.
Do you have any questions for us so far?
Am I getting any more treatments before I leave?
So they have another treatment scheduled in about an hour for you.
Okay.
If things get worse before then, you can give us a call and we'll certainly be back in and we can reassess the situation then.
Okay.
Would you mind if we listen to your lungs at all?
No, go ahead. That's fine.
How's your breathing right now?
It's better than it was.
Okay. Any pain at all anywhere?
No.
Okay. I'm just going to go ahead and take a listen here. You could take some nice deep breaths for me, okay?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
In the mid-16th century, Italians were captivated by a type of male singer whose incredible range contained notes previously thought impossible for adult men. However, this gift came at a high price. To prevent their voices from breaking, these singers had been castrated before puberty, halting the hormonal processes that would deepen their voices. Known as castrati, their light angelic voices were renowned throughout Europe, until the cruel procedure that created them was outlawed in the 1800s. Though stunting vocal growth can produce an extraordinary musical range, naturally developing voices are already capable of incredible variety, and as we age, our bodies undergo two major changes which explore that range. So how exactly does our voice box work, and what causes these shifts in speech? The specific sound of a speaking voice is the result of many anatomical variables, but it's mostly determined by the age and health of our vocal cords and the size of our larynxes. The larynx is a complex system of muscle and cartilage that supports and moves the vocal cords, or as they're more accurately known, the vocal folds. Strung between the thyroid and arytenoid cartilages, these two muscles form an elastic curtain that opens and shuts across the trachea, the tube that carries air through the throat. The folds are apart when we're breathing, but when we speak, they slam shut. Our lungs push air against the closed folds, blowing them open and vibrating the tissue to produce sound. Unlike the deliberate focus required for playing an external instrument, we effortlessly change notes as we speak. By pushing air faster or slower, we change the frequency and amplitude of these vibrations, which respectively translate to the pitch and volume of our voices. Rapid and small vibrations create high-pitched, quiet tones, while slow, large vibrations produce deep, bellowing rumbles. Finally, by moving the laryngeal muscles between the cartilages, we can stretch and contract those folds to intuitively play our internal instruments. This process is the same from your first words to your last, but as you age, your larynx ages too. During puberty, the first major shift starts as your voice begins to deepen. This happens when your larynx grows in size, elongating the vocal folds and opening up more room for them to vibrate. These longer folds have slower, larger vibrations, which result in a lower baseline pitch. This growth is especially dramatic in many males, whose high testosterone levels lead first to voice cracks and then to deeper, more booming voices, and laryngeal protrusions, called Adam's apples. Another vocal development during puberty occurs when the homogeneous tissue covering the folds specializes into 3 distinct functional layers. A central muscle, a layer of stiff collagen wrapped in stretchy elastin fibers, and an outer layer of mucous membrane. These layers add nuance and depth to the voice, giving it a distinct timbre that sets it apart from its prepubescent tones. After puberty, most people's voices remain more or less the same for about 50 years, but we all use our voices differently, and eventually we experience the symptoms associated with aging larynxes, known as presbyphonia. First, the collagen in our folds stiffens, and the surrounding elastin fibers atrophy and decay. This decreased flexibility increases the pitch of older voices. But for people who have experienced the hormonal effects of menopause, the higher pitch is countered and outweighed by swollen vocal folds. The folds' increased mass slows their vibrations, resulting in deeper voices. All these symptoms are further complicated by having fewer healthy laryngeal nerve endings, which reduces precise muscle control and causes breathy or rough voices. Ultimately, these anatomical changes are just a few of the factors that can affect your voice. But when kept in good condition, your voice box is a finely tuned instrument, capable of operatic arias, moody monologues, and stirring speech.
Now look at Extract 2. Extract 2. Questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Tell me a little bit about the progress in the plant-based movement recently.
There's been tremendous progress, particularly in the health field. At least that's certainly my perspective. So in the States, there's just been a real surge, a real tipping point in terms of the plant-based nutrition movement. There are now entire conferences. There's an international plant-based nutrition healthcare conference. Hundreds of physicians, other medical professionals get together, talk about how they're using this in their practice. I mean, that didn't exist a few years ago. I mean, it's really, really exciting. There's new vegan medical clinics opening up. where all the folks on staff are using lifestyle medicine approaches, not just to prevent disease, but to stop and reverse it as well.
Tell me about the main players involved. You've got Nutrition Facts growing, you've got the Physicians Committee doing a lot of work. Who are the main players and what's been achieved specifically in the last few months and last year? What's been the memorable moment for you?
Well, so, a lot of people don't know about Scott Stoll, who started this, PBNHC, this plantrition project, this plant-based nutrition conference. He's been doing these immersion programs for Whole Foods for a long time now. He has a book coming out.
Okay.
I'm very excited about that. He's just had transformative experiences. He's just a physician in practice. There's people all over who've been doing this in their own little, hometowns. But it's just great to get so many people together, start networking. So there's wonderful resources out now, documentaries. We got a number of documentaries coming up, like The Game Changers and Eat Yourself Alive. And this is an exciting time to be in the movement. And I think, a lot of it is just there's so much, we're going to get there if only because the healthcare costs are spiraling out of control, right? Climate change. We're just going to be forced to have to take these, safe, simple, side effect-free solutions, cheaper, safer, more effective than conventional medical approaches, because we're talking about the leading killers, right? The leading cause of death. The good news is that the vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors. We have the power, we have tremendous power over our medical destiny and longevity.
You talk passionately about the benefits of plant-based diet, particularly reversing heart disease. My old boss, he was a professor of epidemiology called Professor Tim Spector. He said he met Dr. Dean Ornish. Dr. Dean Ornish said the thing with the plant-based movement is you get the sense you're either with them or against them. We're going to talk about that in a minute. But also what he said was there aren't any large randomized control trials. He said, Dr. Dean Ornish, show me the large randomized... Why aren't there any? If we've known about this since Pritikin's day, where's the data, the large randomized control trials?
Well, look, Ornish published his first RCT, randomized control trial, July 1990, in The Lancet, the most prestigious medical journal in the world. There it was, black and white, proving with quantitative angiography that we can reverse heart disease, open up arteries without drugs, without surgery, just a healthy plant-based diet and other lifestyle changes. There it was. Right? So we've known about it for decades, but there it was, published in some of the most prestigious medical journals in the world, The Lancet, JAMA, yet what happened? Nothing. Hundreds of thousands of people continue to die of a reversible, preventable disease.
So it's being ignored.
It's being lost down the rabbit hole and ignored. I said, well, wait a second. If effectively the cure to our number one killer could get lost like that, what else is there in the medical literature that could help my patients, but just didn't have a corporate budget driving its promotion? I made it my life's mission to find out. That's why I started nutritionfacts.org, and that's why I wrote my new book, How Not to Die.
What I find very interesting is you say the system needs to take on board this message, but the whole point of Nutrition Facts was to go round the system. Tell me a little bit about the democratization of information and the role that's played and why that's been good for the movement, I guess.
When I started out ignoring the general public and going straight, trying to train the trainers effectively, going around speaking at all the medical schools in the States to try to, get the next generation of doctors educated. But then I realized that's a slow way about it. We don't have time. People are dying now. I don't need to, for another 10 years for them to kind of slowly take over the medical system. People are dying now. We need to take this directly to the people. And thankfully, thanks to the internet age, we now have this democratization of information. Now everyone has access. Before, the doctors had a monopoly on information about health. And so, big pharma, the food industry, all they had to do is get to the doctors. The tobacco industry, as long as they could get the AMA on board by writing them checks for $10 million, and so they came out opposed to the Surgeon General's report against smoking in 1964. As long as they control the doctors, they control the health message. No longer. Now, people can get to the science directly, educate themselves, and we can't wait until society catches up to the science, because it's a matter of life and death.
USDA, I've read their mission is to expand markets for agricultural products. But at the same time, they're coming out with the dietary guidelines. Is that one of the challenges you have in the States?
The USDA has an inherent conflict of interest. The U.S. Department of Agriculture, look, the same thing happened here in Great Britain, right? There was the Ministry of Food and Forestry, right? And then the mad cow debacle came, and they basically dissolved the department, right? Put food safety in charge of, medical professionals in charge of food safety instead of agricultural professionals. Same conflict of interest exists in the States. U.S. Department of Agriculture has this dual mission to promote agricultural products. That's what they're there for. But also, we put them in charge of food safety, meat inspections, helping to come up with the nutrition guidelines. So when it comes to eat more messaging, the message is clear. Eat more fruits and vegetables. There it is, right there in black and white in the dietary guidelines. But what about eat less messaging? Then there's a conflict. So what do you get? Instead of eat less meat, eggs, dairy, junk, what do they say? Eat less saturated and trans fatty acids, things like that. Biochemical components, right? Because they don't want to mention foods because that's too politically unpalatable.
But they'll mention vegetables, they'll mention fruits.
Well, they'll mention fruits and vegetables because it's an eat more messaging. Yeah. Everybody's happy. Promote agricultural products and promote health. If they can do it without undermining the profit motive, they'd be happy to make the American public healthier.
Can you just explain a little bit about how corrupt the medical industry is in the US? It's kind of related to what you've talked about already.
Well, there's a number of barriers for doctors. So you say, okay, we understand why some of the mainstream medical associations are sucking up to industry because they're being sponsored by Big Pharma, for example. But why aren't individual doctors speaking out? Well, there's a severe nutrition deficiency in doctors in education. We just weren't taught this in medical school, so we graduate without these powerful tools in our medical toolbox. We just weren't taught how to teach people to take better care of themselves, right? But of course, there's other barriers. There's lack of time, lack of reimbursement. Doctors aren't paid to tell people how to take better care of themselves. And also, there's much of medical education, both during medical school and postgraduate medical education, is paid for by the drug industry. I mean, the number one reason people go to their doctor in North America is what are called blood pressure checks. And they keep going to get their blood pressure checked so they can tweak the blood pressure medications. And so that's a boon not only to Big Pharma, which sell these chronic disease drugs that people take every single day for the rest of their lives because they're not actually treating the cause of their disease, right? Because they're not actually changing their diet. So they need to be treated every day for the rest of their life. So it's the boon to the Big Pharma, but also that's where the doctor's getting their next BMW from and sending their kids to college. I mean, it's the bread and butter of the GPs, of the primary care docs, is these blood pressure checks, which wouldn't be necessary if they didn't have high blood pressure. The number one killer risk factor in the world, 9 million people dying of high blood pressure, a disease that need not occur if people ate plant-based diet, something we've known since the 1920s.
That is the end of Part C. You now have 2 minutes to check your answers.